So I had a patient who had already been diagnosed with multiple sclerosis and was now needing a rheumatologist, and I had to tell her that she had lupus and Sjogren's. To say she was devastated was an understatement. She was immediately overwhelmed and spiraling. What does this mean? How am I supposed to handle 3 autoimmune conditions? We worked through it together and she is doing well, but it's a scenario I have been a part of many times. So today let's talk about what to do when you have multiple autoimmune conditions. We'll discuss why it's more common than you may think, how to approach treatment, and how to deal with all the different specialists. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. So the first thing I want to say right off the bat, if you find yourself facing more than one autoimmune disease, you are not alone. Finding out you have an autoimmune condition is isolating already, and I have seen those who get more than one diagnosis worry that they are the only ones on the planet with this combination of problems. But having more than one autoimmune condition is actually really common. This is the way I've always thought about it. When some immune systems are exposed to stress, and I'm using the word stress to mean infections or toxins, mental or physical stress. So when someone is exposed to stress, some immune systems are just prone to autoimmunity. So if it happens once, it can happen again. Now, my basic science colleagues are probably rolling their eyes thinking it's more complicated than that, and of course it is. But generally, this is what happens. Autoimmune begets autoimmune, and if you have been diagnosed with one, your immune system has already proven itself to be the type of immune system that leans towards autoimmunity when exposed to the right conditions. This happens so often that there are some combinations that we actually expect to go together. Rheumatoid arthritis and Sjogren's is the classic example. In fact, it's so common to have Sjogren's accompany other autoimmune conditions that when this happens, we call it secondary Sjogren's. Here's a list of common autoimmune combinations that we see. You may hear your doctor refer to your condition as overlap syndrome. The terminology here can get kind of confusing, and honestly for no reason. When it comes to how you feel and how we treat it, which I'll discuss later, whether or not it's called an overlap syndrome or not doesn't really matter. You may have heard me say that every person with an autoimmune condition has their own flavor of that condition. And part of your and your doctor's job is to learn what that flavor is. Well, that's doubly important when you're dealing with more than one autoimmune condition. And as you may suspect, when dealing with more than one, it can take a little more time. Pay attention to your symptoms, write them down, and discuss them with your doctor, specifically asking, is this symptom coming from X or from Y condition? Let me go through some examples so you can see what I mean. Say Bob has rheumatoid arthritis and secondary Sjogren's, which, as I said, is very common. The RA is likely causing joint pain, swelling, and stiffness, while the Sjogren's is causing dry eyes and dry mouth, and both can contribute to his fatigue. Now, let's say Carrie is dealing with psoriatic arthritis and inflammatory bowel disease. She finds that her psoriatic arthritis causes joint pain and swelling and her skin rash, while her IBD leads to belly cramping and diarrhea. Okay, so those were kind of obvious and easy. Now let's look at a more challenging combo. Anne has a combination of lupus and Hashimoto's thyroiditis. This combo is common, but yet not always that easy to distinguish which symptom is coming from which condition. Why is that? Well, symptoms of body pain, fatigue, headaches, weight changes, hair loss, and sun sensitivity can happen in both conditions. So you can see how this is confusing. Unless Anne's test results are able to clarify things, this combo can take time to tease apart. Learning your particular flavor of symptoms and tying them back to each condition as best you can is vital when it comes to developing a treatment plan. Remember, our goal for treatment is always to control inflammation and improve symptoms. So with that in mind, before deciding how best to attack this thing, we need to answer 2 questions. Which condition is driving most of the symptoms, and which one poses the biggest risk to your future health? Once we understand the answer to both of these questions, we can then go hunting. Is there one stone for both or all the birds?
Let's go kill 2 birds with 1 stone.
Sometimes, yes, there are treatments that can impact all the autoimmune conditions, and this is always what we prefer. The less medicine, the better, right? Unfortunately, however, it's not always possible. So in that case, we'll look for the biggest stone for the biggest bird and then go after I don't know, I guess the baby birds with other stones. I don't know. This metaphor has gone away from me. So again, I'm going to go back to our same examples to show how this may play out. So with Carrie, who had psoriatic arthritis and IBD, we'll want to establish which condition is one, the biggest risk to her future health, and two, has the biggest impact on her quality of life. I put the questions in this order on purpose, as oftentimes the risks of inflammatory bowel disease outweigh the risks of psoriatic arthritis. Depending on the severity of her bowel disease, out of control IBD can lead to bowel perforation, which is something we really want to avoid. And although psoriatic arthritis is certainly painful and damaging, it doesn't usually lead to surgical emergencies. So once the severity of each condition is weighed, we can then look for a treatment, and thankfully in this case, there are a number of treatments that can improve both Carrie's arthritis and IBD. So she gets away with just that one stone for both birds. All right, what about Bob with his RA and secondary Sjogren's? In Bob's case, it is likely that RA is driving most of his symptoms and poses the biggest risk for his future health. So the big stone for this scenario will likely be targeting his RA. He will also need specific therapy for Sjogren's symptoms, such as eye drops and possibly referral to an ophthalmologist. For more on how to deal with autoimmune dry eye, check out this other video I did. And then finally, we have Anne with lupus and Hashimoto's. In the same way it will take extra patience to tease out symptoms, it may take longer to find the right combination of therapies for Anne. Through a combination of symptom tracking and careful lab testing, your doctors may need to treat both autoimmunity and hormone deficiencies at the same time. Y'all know I'm not a huge fan of starting multiple treatments at once because it's hard to attribute benefit or side effects to a medicine when multiple medicines have been started at the same time. But this is a case where it's often necessary. One thing you may have noticed throughout all these examples is the need to deal with more than one specialist. In a perfect world, your specialists would come together and powwow about you to jointly come up with recommendations. But unfortunately, we don't live in that perfect world. The reality is most specialists live in their own silos and rely on fax machines or you to convey information. So how can you stay organized? You'll want to take note and utilize your doctor's patient portal to send recent assessments and test results from each of your other specialists. I am purposefully leaving out the combinations that include fibromyalgia or osteoarthritis, as there is just too much to say about those conditions, so I'll have to make a separate video just on those. We've talked about searching for that one stone to get all birds and shown examples of where that may be possible and somewhere it is unlikely. However, we were only discussing medications. Autoimmune symptoms, regardless of which condition they stem from, are usually very receptive to non-inflammatory or anti-inflammatory lifestyle changes. And in fact, those changes may be the one stone you're looking for. Everyone who focuses on and implements changes, even small ones, on things like decreasing stress, moving towards an anti-inflammatory diet, improving the quality of your sleep, moving your body in supportive ways, and improving the quality of your relationships, you do all those things, you'll feel better. If you find yourself facing more than one autoimmune condition or wonder if this applies to you, here are some conversation starters for you and your doc. Do you have secondary Sjogren's, and how would you know? As I've mentioned, it's very common, so if you are seeing a rheumatologist for another reason, ask if you have had your anti-SSA or anti-SSB antibodies checked. These are the standard antibodies checked for Sjogren's syndrome. If you're having significant dry eye symptoms, even if your antibodies are negative, do you need to see an ophthalmologist? Eye doctors will typically have a lot more tricks up their sleeve to help your dry eye than your rheumatologist. Have you had your thyroid function test done in the last 12 months? Similar to Sjogren's, Hashimoto's thyroiditis is very common amongst those with autoimmune disease and is likely underappreciated. If you aren't sure if your thyroid tests have been done in the last year, especially if you are still having unexplained symptoms, just ask. Are you seeing more than one specialist who don't seem to be talking to each other? I tend to be a bit old school, so if you are more tech savvy and keep all of your notes in an app, God bless, keep doing what you're doing. But I recommend getting one notebook with different sections, each section for a different specialist. At each appointment, take notes, especially noting what the doctor thinks is going on and what they want to do about it. At the end of their explanation, ask, can I just repeat back to you what your recommendations are so I can make sure I understand? This magic question forces your doctor to re-explain, hopefully in plain language if you don't get everything right. I hope you can see now how having more than one autoimmune disease is actually pretty common and you are far from being alone. Paying attention to your symptoms symptoms, and tying those symptoms to each condition will help you and your doctor develop a treatment strategy that makes sense and gets you the most bang for your buck. And although there may not be one magic medicine for everything, focusing on key lifestyle elements like sleep, stress, diet, movement, and relationships can help rebalance your immune system and help with symptoms regardless of the diagnosis. I brought up a lot of concepts and conditions in this video, including rheumatoid arthritis, lupus, Hashimoto's, psoriatic arthritis, and Sjogren's, for which I have videos on all of them, so I'll put the links down below. Thanks, and we'll see you next time.